Hello, thank you for selecting Paramount Bed USA as a trusted partner to help you with your patient care needs. We appreciate your hard work, dedication, and all you do for patients and patient outcomes. This training video provides a use overview of the Paramount Bed Sittan Rehabilitation Table. After viewing this video, you will better understand how the Sittan table functions and how to use the Sittan table for early and ongoing bedside rehabilitation. Before using the Sittan table, users shall read the instruction manual and all safety labels to understand safe and proper use, including all warnings and safety precautions. Use instructions presented during this video are for information only. Be sure to follow all applicable policies and procedures for your facility. The Sittan table is a specially designed backless chair used to help support patients unable of maintaining a sitting position without assistance in an upright sitting position. This position has been termed sitting without back support because the patient's head and back are unsupported. In this position, the patient is seated on the edge of the bed with feet on the floor, simulating the orthostatic sitting position. Japanese nurse researchers wondered if sitting without back support could be a nursing intervention initiated early and during ongoing stages of rehabilitation to support improved outcomes and reduce complications. In several studies, sitting without back support was found to either reduce deconditioning, positively impact reconditioning, or improve levels of consciousness in some patients with prolonged altered levels of consciousness. With early research suggesting positive benefits, select Japanese nursing specialties have adopted early upright patient activity with the Sittan table. Example uses include mobilization and rehabilitation of acute and post-acute stroke patients and respiratory failure patients in ICU and non-ICU settings. Physiologically, sitting without back support is thought to yield benefits by triggering the activation of cerebral cortex and brainstem reticular formation and by increasing cerebral blood flow. Additionally, it stimulates the sympathetic nervous system, which is believed to contribute to reduced disuse syndrome and improved consciousness levels in some patients. Prior to using the Sittan table, assess the following criteria to ensure the patient is an appropriate candidate. Patients shall be hemodynamically stable. They shall be able to support one's own neck to maintain an effective airway. They shall be physiological condition appropriate for sitting upright while keeping feet flat on the floor. And they shall be free of agitation, confusion, and combativeness. Failure to meet these criteria may adversely impact the ability to safely use the Sittan table. The aforementioned criteria is guidance only. Use clinician discretion to ensure appropriate use of the Sittan table. Use the Sittan table under direct supervision of a qualified caregiver. The Sittan table is assistive equipment to help patients sit upright for patients who would normally be unable to sit upright on their own without support. It is not intended to restrict body movement or be used by caregivers to restrict body movements. Next, evaluate the patient's size to ensure the patient will fit into the Sittan table when seated on the side of the bed in an upright position. The Sittan table width is 26.5 inches. The depth is 30 to 37 inches. Finally, ensure adequate knowledge of the Sittan table components and their use. We have the back cushion, support belts, tabletop, elbow pads, abdominal support pad KF-80U, the Sittan base support poles, the fixing bolt, height adjustment lever, front casters with stopper, and the legs. Support pole, back unit holder, back fixing bolt, depth adjustment pipe, depth adjustment lever, and the folding lever. Now you'll set up the Sittan table. You want to adjust the table height as needed to fit the patient when sitting on the edge of the bed, feet flat on the floor or support surface, and knees bent approximately 90 degrees. There should be an adequate space between the tabletop and the patient's legs. Use caution when tightening or adjusting knobs, levers, table height, table depth, etc. So you use care not to get your hand or finger caught, as injury may occur. To raise the tabletop, you're going to adjust both sides simultaneously. First, you'll loosen the left and the right fixing bolts. And then you'll lift up on the table to whatever desired height. And then you're going to tighten the fixing bolts to secure. To lower the tabletop, you're gonna adjust one side at a time. First, you loosen the fixing bolt a couple rotations, lift up on the table height, depress the height adjustment lever, and go down to the height you want. In this case, we're at level 5. You tighten the fixing bolt and move to the other side. In this case, we're gonna loosen the fixing bolt a few rotations, lift up on the tabletop height, adjust it down to position 5, secure it in place, and tighten the fixing bolt. Next, you're gonna attach the back unit to the sit-in table by inserting the back unit support pole into the back unit holder. And you're gonna secure that on one side, tightening the back fixing bolt. Next, we're gonna pull out the depth adjustment pipe on the other side. To do this, we need to pull out downward on the depth adjustment lever, move the depth adjustment pipe, in this case about midway back, secure it into place, and releasing the depth adjustment lever locks it. Now you're ready to position the patient into the sit-in table. Since patients sitting in the sit-in table have limited mobility and are unable to sit upright independently, ensure 2 or more caregivers work together to position the patient in the sit-in table. If you've not gotten your support staff, be sure to do so now. Together, you'll sit the patient on the side of the bed, ensuring the patient is far enough onto the bed. I've assisted the patient into an upright position with knees about 90 degrees, feet on the floor in preparation to secure the table into place. My caregiver colleague brings the sit-in in. We're going to position the sit-in in front of the patient. We're going to place the arms onto the sit-in table and position the table as far back as it'll go. You can use the elbow pads underneath the arms for additional support between the table. There go black side down. Now we're going to secure the stoppers on the front casters. If the wheels are turned straight back, you may have difficulty accessing the stopper. Just maneuver the wheel around to gain access. Now we're ready to position the back unit onto the table. We're putting the support pole into the back unit holder, tightening the back fixing bolt, pulling upright to double check that securely into place. And now we have too much space between the patient's back and the back unit. So we're going to adjust the depth adjustment pipe by pulling down the depth adjustment lever, pushing in as far as we need to go until we get a good amount of space for support behind the scapular area with the back unit. The sit-in comes with support belts on each side. If the patient needs additional upright support, you can position these into place. These never go across the chest. They always go down the side in which they originate on the back unit. They go under the front of the shoulder area and they snap with the buckle in the back. This is too loose for her, so we just adjust the straps to a tighter position for adequate support as needed. This is a patient sitting upright in the sit-in table. We have good support in the back. We have an adequate amount of space between the patient and the abdomen area and the sit-in table. Now you want to perform a safety check after setting the patient up in the sit-in table. First, you want to look and see, are the stoppers of the front casters locked? Also note the level surface of the flooring. If the floor is uneven or the casters are not locked, the casters may move and the table may tip, resulting in patient injury. Next, you want to look at the back fixing bolts. Make sure both of them are tightened properly. If the back fixing bolts are not tightened properly, the back unit may come up and detach, suddenly causing an injury. Next, look at the patient's posture and position on the bed. Is the patient sitting far enough back on the bed? If no, the patient might slide off and be injured. Are the patient's feet touching the floor and are the knees at an angle of about 90 degrees? If no, consider adjusting the height of the bed if able, or placing a footstool under the feet for support. And then look at the elbows. Are the elbows at an angle of about 90 degrees and supporting the patient's upper body? If no, the tabletop may need to be adjusted. Refer to the instruction manual for how-to guidance for the tabletop height adjustment. Next, check to see if there's a suitable gap between the tabletop and the patient's abdomen. If the gap is too large, the patient may slide off the bed and be injured. If there is no gap, pressure may be applied to the patient's abdomen and lead to injury. If the table abdomen gap is not ideal and the patient is sitting far enough onto the bed, change position of the table. If the abdominal support is needed, consider support pad KF80U. If support belts are used, are they secured appropriately? They should be secured on the same side of the belt origin, never crossing the patient's body. Do not place objects exceeding 66 pounds on the tabletop. There is no patient weight capacity for the Sittan rehabilitation table. The patient dimensions and the abdominal girth and patient size are going to dictate whether or not the patient's an appropriate candidate for Sittan table use. To remove the Sittan table, perform application steps in the reverse order. The Sittan table folds and stacks for easy storage. To go from the horizontal position to the vertical position, you press the right and left folding levers, angle the tabletop vertically, and position into place. To get the tabletop back into the horizontal position, you press both folding levers and adjust to horizontal. While the Sittan table is positioned with the patient, you never touch the folding levers. To prepare the Sittan table for storage, we're going to remove the back unit, shorten the depth adjustment pipes to their shortest position. We're going to pack up the back unit by placing the elbow pads inside and wrapping the support belt around. We're going to position the table to the vertical position. This exposes the storage bracket with notches. We're going to align the support pole on the notches, hanging the back unit in place, ready for storage. Multiple Sittan tables can be stacked together for storage. A few safety considerations to remember when preparing for storage. When folding the tabletop or the back unit, be careful not to get your hands or fingers caught. Injury may occur. Prior to movement, ensure both stoppers are released. If not, damage may occur to the floor. Once ready to position the unit into storage, roll supporting the tabletop with your hand. Full guidance for long-term storage is provided in the instructions manual. Reference as needed. During storage, do not place any objects on the table. Store the table on a level surface with both casters locked. To ensure safety, have regular qualified inspections of the Sittan table at least yearly. In addition to the annual inspection, caregivers should assess the Sittan table for loose parts, damage, and effective operation of moving parts regularly. If any component is broken, damaged, or not functioning as intended, do not use. Remove the Sittan table from clinical use and arrange for repair or component replacement. Clean and disinfect the Sittan table prior to initial use and after each subsequent use with approved cleaning and disinfecting solutions only. The yellow back support cover is removable for cleaning and disinfection. If the cover is worn or becomes too soiled for adequate cleaning and disinfection, replacement covers are available. Do not use volatile cleaning solutions or disinfectants other than those listed in the instructions manual, as damage, discoloration, or deterioration may result. Thoroughly wipe off parts with a damp cloth soaked in clean water after using detergents and disinfectants. Not doing so may cause cracking of the resin. Thank you for your time and for all you do for patient care. If you have any questions, feedback, or repair requests, please contact Paramount Bed USA at 800-910-5703. Email service@paramountbed-us.com or contact your distributor. Thank you.